interpret today's conversation. I'm going to start with the numbers. As of this morning, I talked to Greg Kesterman, the health commissioner, this morning. We have 52 individuals who have tested positive for COVID-19 in Hamilton County, 5 hospitalized, and 0 deaths. It should not be a surprise, though, that as testing continues to ramp up, the numbers are going to rise. While nobody has the power to save this crisis immediately, there are critical things we can all do. Chief among those is to stay home, no matter how frustrating this can be. There are already early signs that staying home is working. I don't know how many of you got to see Dr. Amy Acton yesterday, but she has said that based on the statewide data, we are already saving lives by flattening the curve. And remember, the whole effort here is to flatten the curve to allow us time and capacity building for what we know is coming, which are increased numbers of people that need medical attention. Before we hand off to today's speaker, Krista Hyson, she's the Public Information Officer from the Health Collaborative, I'd like to provide an update on the county activities that continue to serve the citizens of Hamilton County. So we've talked a lot about what's going on in the community, really community-wide information over the past few days. Right now, I'm going to focus in on what Hamilton County is doing in order to respond to the crisis. Couple of examples. At JFS, with more workers than ever working from home and remotely, staff is responding to a near 100% increase in food assistance applications. Remember, these are the employees that are also going out into the field to make sure that seniors and kids are safe in our community, and they're doing that remotely. Our Planning and Development Office continues to ensure building permits are reviewed and inspections take place so that residential and commercial construction can continue, even with a closed administration building. Even more impressive is that they are turning around inspections in 24 hours. And to bring a little bit of clarity to that, so while some of the folks in this building are working, in fact, many are working remotely, we do have an access point down on the first floor. So if you need something from planning and development, you literally need a piece of paper, maybe it's oversized and we can't get it to you via email, you can call buildings and inspections, buildings and planning, call the number. They will walk that down to you by appointment. And so we are trying to provide as much access to those documents as possible. Our 911 operators continue to come and work and handle our community's most pressing needs with skill and with courage. The county's Office of Reentry is finding ways to communicate with clients leaving the Justice Center even while working remotely. Our purchasing staff are working hard every day to source materials and PPE, the personal protective equipment, to keep our first responders safe during this crisis. And none of our essential operations could continue without our facilities team. County facilities employees continue to go above and beyond to keep our buildings operational, safe, and clean during this incredibly stressful time. So just an overview of some of what's happening at the county. On another subject, there are 2 urgent messages hospitals would like to get out to the public. First, if you have a minor ailment or injury, do not go to the emergency room. Go to your primary doctor or call your primary doctor or urgent care. Second, delivery wards are safe for pregnant women. There have been a few women who have elected to stay home and had unplanned home births, which we would like to avoid. So again, the pregnancy wards are open and safe. One final note. Our health department is overwhelmed with calls from businesses who don't understand whether the governor's stay-at-home order applies to them. Different health departments are reading the order differently, and we need a statewide approach. We will be working with the governor's staff on possible fixes to this problem. I was on a call yesterday with the governor and the lieutenant governor and expressed our concern that the uneven application of the stay-at-home order has been very challenging and that our local health department now is becoming overwhelmed because of some of the confusion that's been created. And so we are pleading with them to create a statewide hotline that can be utilized by everyone throughout the state of Ohio so that we have consistent application of the stay-at-home order. So more to come. I'm hopeful that we will get that state hotline. Now I'd like to introduce our guest speaker, Krista Heisen from the Health Collaborative. The collaborative coordinates response and recovery from disasters, public health emergencies, and other catastrophic incidents requiring a unified response. We've gotten a lot of questions about what the hospitals are doing, about our capacity for treating individuals that have COVID-19. And so we've got an expert here today. So welcome, and we look forward to hearing your comments. Thank you.
Thank you for having me, Commissioner Dreihaus, and thank you, Jay, for being here. My name is Krista Heisen. I serve as the Public Information Officer for the Greater Cincinnati Disaster Preparedness Coalition at the Health Collaborative. The Health Collaborative is a nonprofit organization based in Cincinnati. We bring together those who provide care, pay for care, receive care, to find mutual solutions to challenging problems like COVID-19. The Health Collaborative has the privilege to run the Greater Cincinnati Disaster Preparedness Coalition. This coalition facilitates regional collaboration. Excuse me, I've been speaking 12 hours a day, every day. This coalition facilitates regional collaboration and resource allocation among all members in the response to COVID-19. Members include hospitals, emergency medical services, emergency management, public health departments, and other community partners in the tri-state region. The Greater Cincinnati area is unique in that its hospitals, health systems, public health departments, first responders, social service agencies, and local governments have been working together for years to make sure our region is trained and equipped to handle this type of outbreak. Regular trainings and exercises prepare our communities for public health crises as well as natural disasters and acts of terrorism. Our small but mighty team is currently fulfilling requests for personal protective equipment, or PPE, for our coalition members through our regional cache. PPE refers to protective clothing, masks, gloves, face shields, and other equipment designed to protect the wearer from injury or illness. If you have donations of PPE, please call 513-263-8200. That is 513-263-8200 for donation drop-off and additional information. I wanted to take a few moments to address a few items and ways you can help our community. To take the burden off our hospitals, remember that urgent care centers are open for business. If you are suffering from a non-emergent condition, such as an ear infection or broken arm, reach out to your local urgent care if you do not have a primary care provider. They are available and offer a wide variety of resources, such as eye care to taking care of lacerations to burn care. Just try not to use emergency rooms if it is truly not an emergency. If you are an expectant mother, know that hospitals have taken extra precautions, and this is still the safest place to deliver your baby. Visitation policies, while different at this time, still permit your asymptomatic spouse, partner, or caretaker to be with you. To adhere to the governor's guidance on safe social distancing practices, Hawksworth Blood Center is not accepting walk-in donations at this time. However, you can make an appointment for a time and location that is convenient for you to donate blood. Blood donation is a powerful way you can help your community. In addition to donating blood or PPE, you can also donate money to the many foundations supporting our healthcare workforce. You can even write cards or letters to residents at our city's assisted living facilities and nursing facilities that currently can't accept visitors. I also wanted to address handmade masks. While this is an incredibly kind act of service, hospitals are not currently utilizing homemade masks. These will be used as an absolute last resort. Our area hospitals are continuing to be creative and exploring innovative ideas to provide effective and safe tools for our healthcare workforce. Lastly, I wanted to discuss the surge capacity of our region. As mentioned in previous press conferences, our region collaborates with all hospitals on medical surge planning and preparedness. This means that a hospital can expand bed capacity under certain conditions to accommodate and serve an increased number of patients requiring hospitalization. In this region, we have done this and have practiced this bed expansion process successfully. While I cannot go into specifics for an individual hospital's tactical plan due to safety and security reasons, the regional plan includes 3 surge levels. At surge level 1, hospitals will initiate internal surge plans to accommodate the identified needs. Internal hospital strategies employed at this level may include things like calling in additional staff. At surge level 2, all available healthcare facilities identified surge areas will be utilized. This includes the use of converted patient care areas or establishing an alternative care site. At surge level 3, this would be a community-wide or region-wide surge. Increased capacity will be created by activating local jurisdictional plans that include activation of regional, state, and federal resources, such as the activation of the National Disaster Medical System. Currently, we are not in a dire situation or at a surge level. We are monitoring it closely. Depending on the specific hospital capacity could grow from 20 to 50%. But in order for this to not become a dire situation, we need your help. Staying home and exercising proper social distancing helps limit the spread of the virus. In addition to adhering to the governor's stay-at-home order, our region is taking steps to prepare hospitals like conserving PPE, practicing changes to safely reduce PPE use when possible, exploring options for PPE recycling and reuse, screening and triaging patients prior to entering hospitals, leveraging telehealth appointments when possible, limiting visitors, limiting patient care area to essential personnel only, and canceling elective procedures. I also wanted to mention that I am unable to provide specific numbers regarding total bed count, ICU beds, PPE, ventilators, testing supplies, and staffing. These numbers are fluid and constantly changing, as requests for PPE, for example, are fulfilled through our regional cash, donations, and other sources. In terms of testing and testing numbers, note that until our region receives more test swabs and testing kit materials, for the most part, we will be testing tiers 1 and 2 as defined by the Ohio Department of Health. This includes inpatients at hospitals and other healthcare facilities, including long-term care, with symptoms suggested of COVID-19, and healthcare workers at Tier 1 institutions with symptoms, and all individuals in public safety occupations, such as police and fire. What's more important than number of beds is that we abide by the governor's stay-at-home order in order to protect our healthcare workforce. Staying home limits the spread of disease. Can we increase our bed capacity by 50%? Yes. But if we do not have the nurses, doctors, and staff to take care of us, we will be in a dire situation. The most important thing for Greater Cincinnati residents to do is to continue prevention measures, such as following social distancing procedures at the stay-at-home order outlined by local and state governments, clean your hands frequently with soap and water for at least 20 seconds, cover coughs and sneezes with elbow or upper arm. If you have symptoms, please call your primary care provider. If you do not have one, please reach out to your closest urgent care. A physician will then guide you with next steps. Please do not show up to an emergency room without calling first if you are exhibiting serious upper respiratory symptoms like shortness of breath. For questions and additional information, please visit the website of reputable sources such as Hamilton County Public Health, the CDC, or the Ohio Department of Health. And the Ohio Department of Health hotline for all questions is 1-833-4-275-634. And that phone number is 1-833-4-275-634. Thank you.
Thank you, Krista. Really great information. I think you've already answered a lot of the questions that we've been hearing. A couple of housekeeping things before we get started with the questions. We are not going to be here tomorrow or Sunday, as you might imagine, and so we'll be back on Monday. We're going to have members of the Fire Chiefs, the Hamilton County Fire Chiefs Association here, along with Andy Knapp. He is the director of the 911 Communications Center, and so these are our first responders. They're the front line. And so we've also received questions and concerns, frankly, about how they are doing and how they are able to respond. And so we're going to have them in and we're going to talk about the emergency response countywide. So I think that will be a very useful conversation. Also, as you know, we're receiving questions, some of which I frankly cannot answer. I am not the Commissioner of Health, and Greg Kesterman is not here every day because he is overwhelmed with the work that he is doing, and I frankly don't think it's a very good use of his time. And so, but I am happy to take questions, convey them to him later in the day, and come back with the responses. And so I have done that. I've taken it upon myself to do that because there was a question yesterday about carryout and about groceries, and I gave you the advice that I had heard Greg give to others, but I asked him more specifically about this question, and so I'm going to read his response. He says, there is no known spread of COVID-19 through food. Customers should wash their hands immediately after shopping. Wash fruits and vegetables with water. Wash hands after handling money and credit cards at a drive-thru. If you want to be extra careful, put carry out on a clean plate at home rather than eating straight out of the container, and then wash your hands. So wash your hands, wash your hands, wash your hands, which Greg has been saying over and over again for weeks now. So with that, Bridget, I think we're ready to go to questions.
We are. Teresa Weaver from Fox 19 has a question for Krista with the Health Collaborative. We are hearing that some nurses are having to take PTO time because same-day surgery and other procedures are canceled and they are not needed at the ER and hospital at this time. What is the hospital capacity? We believe, and perhaps wrongly, that our hospitals are nearing capacity, and there is concern of not enough beds.
So I think I addressed most of those in my statement, but right now our capacity is very good in the region. I can't speak for specific hospitals' policies around nurse PTO. However, that surge level 1, if we hit that, that would be the call to adding that additional staff that usually maybe takes those elective procedures. So those nurses would definitely be in use.
As a follow-up from John London from Channel 5, does the county plan to, are university medical students who are nearing graduation available to assist in any way?
So match day just happened for our area medical schools and medical schools across the country. So that would depend on where they got matched, and they would be reporting to that institution. So match day is when medical students find out where they go for their residency and where their specialty is.
Are there any other measures being put into place for backup doctors and nurses, such as retired doctors and nurses?
So that has been in discussion. That national call has not gone out yet in Ohio, but is always a possibility.
How do you ensure, or can you ensure, PPE doesn't run out for healthcare providers who check on the elderly?
So we make sure that we're practicing all those PPE conservation things that I mentioned before, and making sure that it is only utilized when necessary, because sometimes it's not always necessary. So conserving it for those cases that it is.
And this might be a repeat, but what is the plan for the projected wave of cases in the next 2 to 3 weeks?
So it'd be that surge capacity, that level 1, level 2, level 3, if that happens.
What concerns, if any, do you have about the president's new social distancing guideline plan to identify high, medium, and low-risk counties with an eye towards reopening the economy piecemeal?
I'd say at this time, it is best to follow Governor DeWine and Dr. Amy Acton's social distancing guidelines at this time.
Thank you. A question from Scott Wortman, and this could go to either. The stockpiles of PPEs being revealed around the country, including a large government stockpile in Indianapolis from Customs and Border Patrol. Have there been any organizations out there with a large collection of PPE in the region?
So as for individual organizations, different organizations have definitely stepped up and said, hey, we've had these, such as dentists and veterinarians and places like that, but we haven't received large donations such as that.
Can I also add on to that? So I just heard on the news this morning that Union Terminal has donated equipment, that the Art Museum has donated equipment. And so in small measure, which is great and very generous, folks in this community are stepping up. I mean, and when you think about it, it's like, well, why would the Art Museum have masks, for instance, or gloves? Well, they do because they deal with artifacts and documents that are very old, and they have to be very careful when they interact with those documents or the sculptures or whatever they are. And so they've been very generous in offering those supplies. They are smaller in number, I think, than what the question referred to. But I will say that as we all work our way through this, we're trying to offer a coordinated response for that equipment. And so whether it's through the national stockpile that has come down, which was helpful, but not enough. And as we order from vendors who are ramping up the production of these supplies, we are trying to make sure that there is a bit of a tiered approach here. And so medical professionals, frontline employees are obviously at the very top of the list, and then they work our way through the list. And so those folks at the Art Museum, for instance, who don't have to interact with those documents at this moment in time, they don't need the equipment, right? So we're trying to figure that out in a really, what I think is a very common sense approach, but it's also a community-wide approach. And so we're all in it together. We're the county, the hospitals, the emergency management. We're all trying to coordinate our efforts to make sure we're doing it in a really strategic way.
Thank you, Commissioner. This question is for you from John London at Channel 5. What is being done at the local level to address problems being able to file for unemployment? Many have tried for days and cannot get access.
Good morning, John. So I have gotten this question a number of times in the office. So as many of you know, unemployment benefits are handled by the state. And so we don't have a lot of authority, nor do we have a lot of interaction with how that's going. I'm going to provide the numbers and the website once again, and then offer a little bit more information. So if you need unemployment or need to contact the unemployment office, it's unemployment.ohio.gov. If you do not have access to a computer or would prefer to make a phone call, the number, and I will go slow, Jay, is 1-877-644-6562.
A follow-up on that.
Bridget. So I wasn't finished. So I do want to say that I know this is a frustration, and unemployment specifically is handled by the state. But that said, there are some individuals that have found themselves in a situation where they need some assistance, whether it's cash assistance, food assistance. And so our local JFS office might be able to help. You do have to qualify for the assistance, but I think oftentimes it is worth that phone call. And so you can go to that website, which is I don't have my glasses with me. Hold on. It's rough. hchjs.org, hchjs.org, or call 946-1000. Sorry about that.
A follow-up on that for unemployment. And the question is, what does it say about a system that tells people to file for joblessness assistance and cannot handle the demand?
Yeah. So there has been a dramatic increase to the demand for unemployment assistance because of so many people in this community who have been laid off, or the doors of the restaurant have closed, at least for this moment in time. And so there has been an 8,000% increase in calls for unemployment assistance. And so while I recognize that people are really frustrated by not being able to get through, I don't think any agency is ready for an 8,000% increase in call volume or website volume. And so I encourage people to continue to try. I know it's frustrating. There's so many people in need in the community at this moment in time, but please keep trying, and hopefully you've got the information you need to do that.
That seems to conclude our questions for today.
All right, very good. So thank you all. Thank you, Krista, so much for being here from the Health Collaborative. Jay, it's always a pleasure. So as I said, we will not be here tomorrow or Sunday. We'll be back on Monday with additional and updated numbers, and then with some information from our first responders in Hamilton County. So I just want to remind everybody that we know what to do. You need to wash your hands. You need to stay home. You need to practice safe distancing. And if you don't feel well, call your doctor. The whole idea here is to flatten the curve. And we heard yesterday that we are flattening the curve, but it will only be if we continue to do the things we know we need to do to make our community safe and save lives. So thank you all for everything you're doing in the community, and we'll be back on Monday. Thank you.